Dear students, my name is Dr. Fauzi, and in this lecture, I will talk about the diagnostic aids other than radiographs. So we have two types of other diagnostic aids. These are the study models and photographs, and each of them has its own importance in the diagnosis and the treatment. The first one is the study models. So orthodontic study models are essential diagnostic records which help to study the occlusion and the dentition from all three dimensions. Study models should show all the erupted teeth and be extended to the buccal sulcus, and traditionally they are poured in dental stones, and they are typically produced from alginate impressions. So you can see here the study models from the front and the side view. Nowadays, a digital version of study models are made which should not deteriorate with time, and they are easy to transfer and do not take up physical space. They are gradually replacing the stone models. Those are the digital study models, and they are made by intraoral scanner, and they can be manipulated and used to make many things like space analysis. So what are the requirements of study models? First, the model should accurately reproduce the teeth and the surrounding soft tissue. As you can see here, they show the teeth and the surrounding soft tissues. And the model should be trimmed so that they are symmetrical. So you can see here that the models should be trimmed with the aid of a trimmer, and this trimming should be symmetrical. So sometimes we can use a mold to make the base of these study models. And the models are trimmed in such a way that the dental occlusion shows by setting the models on their back, like in this case. So when you put those models on their back on the tables, then the teeth should be in occlusion. So they are trimmed, should be trimmed in this way. And this is, you can see here, the extra stone, and this stone should be trimmed with the aid of trimmer. And the models have to have a clean, smooth, and bubble-free surface with sharp angles where the cuts meet. So you can see here, this model is not a great one. It's not a good one because it's not smooth, sharp, and has some bubbles. So this is not a good study model. That's one. So why do we make study models? First, they are the only three-dimensional record of the patient dentition. So when you take a study model, you can see the teeth in three dimensions. So it's a three-dimensional record of the teeth. And occlusion can be visualized from the lingual aspect. So this aspect, we can see the whole occlusion. Lingually, you can see, or palatally, you can see the occlusion, which is normally cannot be seen intraorally. So this is an advantage. And they provide a permanent record of intermaxillary relationship and the occlusion at the start of therapy, and this is necessary for medico-legal consideration. So you can see here we have a patient with a class 2 malocclusion, so you can visualize the intermaxillary relation. You can visualize the crowding in the upper and lower arch, and this is important also for the diagnosis and treatment planning. And there are visual aids for the dentist, as he can monitor changes taking place during tooth movement. So you can monitor the changes and the kind of tooth movement you need when you look to the study modules. They help to motivate the patient, as the patient can visualize the treatment progress. So study models always remind the patient of his condition. So you can see here if the patient have an erupted canine and anterior crossbite in the lateral incisor and crowding in the lower arch. So the patient can see the results, and he can be motivated when he compare the before and after results. So usually, study models, they are used to assess and record the dental anatomy. So the dental anatomy of the tooth, if there is a tooth that's abnormal or abnormally shaped or formed, then the study models helps a lot. And also it can assist and record the intercuspation of teeth. So you can see like on the right side, there is no intercuspation in the teeth. Anteriorly, there is an open bite, and even on the left side, intercuspation is somehow better than the right side. So this is something we can see. Third point is to assess and record the arch form. So we can label some points on different teeth, like here in the canine, premolar, and molar, and we can measure the intermolar, intercanine, interpremolar distance, and we can shape the arch form. So we have different types of arch forms. We have the tapered, square, and ovoid. And the second advantage is assess and record the curves of occlusion. So we have the curve of Spey, and we can record if there is an increase or decrease in the curve of Spey. You can see that the right side has a 1 millimeter curve of Spey. So the curve starts usually from the canine to the molar. This is the curve of Spey. And on the left side, we have a 3 millimeter curve. And also, study models evaluate occlusion with the aid of articulators. Sometimes we mount the study models on the articulator. We attach them to the articulator, especially in case of orthodontic surgery. And study models are feasible record that can be mounted on the articulator, which sometimes could be very helpful. And we can measure the progress during the treatment, measure the progress of tooth movement, the progress of the case during treatment. Study modules are consisted of two portions, two parts. The first part or portion is the anatomic portion, and the second one is the artistic portion. So the anatomic portion is the part which is the actual impression of the dental arch and its surrounding soft tissue structures. This is the part which must be preserved when trimming the model. So this is the anatomic portion, consisted of the teeth and the soft tissue. The second part is the artistic portion, is the stone base supporting the anatomic portion, and this portion is trimmed in a manner which makes in a general way the dental arch form as pleasing to the eye. So this is the artistic. So study models, they should be trimmed in a different ways and in different parts. So in sequence, we can first trim the lower base parallel to the occlusion. This is the lower base. And then we trim the lower back perpendicular to the base. So first is the lower base and then the lower back. The third, with the models in occlusion, they should occlude together in intercuspation. Trim the upper back so it flush with the lower back. Both backs, they flush together, they are parallel with each other. Then place the upper model and its back on the model trimmer and trim until the top base is flat, until the base of the upper part is. Then occlude the models again and take the bases for parallelism if they are parallel, and backs are flush in a flush plane. And then make buccal cuts at the edges of the vestibule. It should be about 60 degrees to the base of the model, the edge of the vestibule, the buccal cuts, and then make a smooth curve from the canine to the canine in the lower model, in the lower arch. It should be like that. Move the trimmer, the model trimmer guide to its extreme position to make the heel. You should make an angle which is 115 degrees, and then make buccal cuts at the edges of the vestibule, which is 60 degrees back of the upper model, and then occlude the models and trim the upper heel so they flush with the lower heel. They should be together, and then make the anterior cut in the upper, the ends of which should be at the midline, so they meet at the midline and the middle of the canines, and occlude the models, and they should have a sharp 90-degree angle between their bases. So their bases are parallel, and they should have a 90-degree angle between the base and the back. So this is the way of trimming the study models. Finishing the models. First, the surface must be smooth and remaining at the same time absolutely flat at right angles to the base of the models. Second, the surface, after the surface has been finished, the exact dimensions achieved, the models is set aside to dry, has to dry for 48 hours or dried overnight in our orthodontic oven at a low degree. At this point, the models should be labeled with the patient name, for example here, FA, the patient name, and the date, and the number of the case. You can write the name of the patient or abbreviation of his name and the date. The final glazing is put on the models by immersing them in a commercial gloss so that the appearance will be glossy, and the models allowed to remain in this solution for 1/2 hour. Thank you for listening.